Breast cancer is one of the most common cancers among women in the United States. In fact, 1 in 8 women will be diagnosed with breast cancer sometime during her life. But if detected early, it's almost entirely curable. There are a lot of tests and exams that go along with taking care of your breasts, and they are essential in keeping them healthy. It's important for women over the age of 20 to be familiar with their breasts.
I usually would recommend starting by looking at your breasts in the mirror and seeing if you see any differences. Things to look out for would include changes in the ways the nipple are pointing, if one nipple appears to be pulled in compared to the other, any changes in the skin, such as red skin or warm skin, or an appearance of your skin that looks like an orange as opposed to a smooth appearance. So it's important to actually feel them as well, both lying down and standing or sitting up. If you feel any breast lumps or lumps in your armpit, it's important, even if it's a small lump, to come in and be evaluated.
If you're 40 years old, you should begin getting annual mammograms. If you have a family history of breast cancer, talk to your doctor.
Most breast lumps and breast complaints turn out not to be breast cancer, but it's very important because if we find breast cancer early, we can treat it and cure it. Whereas if you let things go and the breast cancer is allowed to spread to your lymph nodes in your arm or to other places in your body, it can be much trickier or even impossible to cure.
Mammography is a powerful detection tool. Here are some things to keep in mind before getting a mammogram.
Doing mammograms starting at age 40 can save lives and find breast cancer earlier when it's at a more treatable stage. For most women, it's a relatively quick and painless procedure. There are some women that have tender breasts naturally that have a little bit of discomfort. We can usually complete a mammogram in about 20 minutes. There was a shift recently in the past few years to almost universal use of digital mammography, and the picture is just much clearer with digital mammogram. So it's important to try and find the best quality of mammogram that you can find in your area. Only about 10% of the time or so do we find any problems on mammogram where we need to call people back for additional images. It's important to let yourself know that people are using this screening tool to be careful and make sure that there's nothing going on. And for the most part, that's what we find.
Screening tests are intended to find breast cancer early, before any symptoms can develop. 96% of women who are diagnosed and treated early will be cancer-free after 5 years. For Ben Memorial Clinic, I'm Victoria Adeulus.